This is Ben Gelfand from Technique Peak. Today I would like to talk about a common technique that we use in our clinic, probably on most knee patients that we do. It involves palpation and mobilization of the patella. In my experience, the best way to figure out the borders of the patella is by going from the middle of the middle pole of the patella, if you will, and feel around the borders. You have to feel fairly aggressively in order to understand where the borders are. So here's a superior border, this is the lateral border, medial border, and inferior border. And I'm doing that because I fall off the patella as doing it. Now, in order to do the mobilizations, the main directions that are therapeutic are both superior and medial. We know that patella tracking very often occurs with a natural bias to go laterally, so we don't need to go out in that position, and it may cause an apprehension sign or subluxation of the patella. And post-surgically, patella baja, or the pulling down of the patella, can be a problem. So we want to avoid that by going the opposite motions. So again, I'm going to look at the borders of the patella, and I'm going to move with a fair amount of aggressiveness and assertiveness, looking for the end feel, the quality of movement in the end feel, and move medially. And then I will bring it back to center, and then move medial again. I like to hold that position for a few seconds, 2-3 seconds, again, depending on the end feel, and then bring it back. I do a series of 10 to 20 mobilizations, then give a rest and check for increased mobility. Then I will do it again as needed. This has been Gelfand for Technique Peaks.